vaccination. Now, vaccination, there is a large body of evidence, right, that showcases the benefits and the effectiveness of COVID-19 vaccination. And that body of evidence is extensive, and they all point in one direction. It shows, and it has been proven locally, that vaccination reduces the risk of getting COVID-19. In addition, it reduces the risk of becoming severely ill due to COVID-19. It reduces hospitalization and deaths due to COVID-19. And also, vaccination adds to the number of persons in the community who are protected from getting COVID-19. In the grand scheme of things, this makes it harder for the disease to spread in the community. And we get that concept of herd immunity. Also, and finally, vaccination reduces the spread of the virus that causes COVID-19. And in so doing, it reduces the chances of the virus mutating and possibly becoming more resistant to vaccines. So we really need to get ahead of the curve. And I want to encourage persons who are not yet vaccinated to go out there and get vaccinated. Take that decision to protect yourself, your loved ones, your household, your workplace, and your community, right? This is a collective effort, right? And always remember, you need to combine that with the public health and safety measures. All right, thank you.
Thank you, Dr. Charles. Members of the media, just quickly, because Dr. Charles has to leave us shortly, if you have any questions specific to what she presented this morning, you may ask those questions now by indicating either by a raised hand or a quick message in the chat. So just to repeat, Dr. Charles has to leave. So any questions? Okay, Mikey Hutchinson, I see you have a question. Please proceed.
Okay, good morning to the panel. Good morning to Dr. Charles. I noticed you mentioned that there is a decline in persons who are taking the second dose of the vaccine. So I know that you take your first dose and then you take a second dose. So what happens to those persons who have had a first dose and they would have missed that window that was given to them to have the second dose? How long after missing that window are they considered unvaccinated?
Thank you for your question, Mikey. An important question. There has been a decline in persons coming forward to receive their first dose, as well as the second dose. Now, in regards to the AstraZeneca vaccine, now persons that lack period, that period between your first dose and your second dose, based on guidelines, manufacturer guidelines, is 4 to 12 weeks. As it relates to the Pfizer vaccine, that period is 21 to 28 days, right? And we strongly encourage everyone who have received the first dose to come to receive your second dose, because you will only be considered fully vaccinated 14 days after receiving your second dose of a 2-dose regimen vaccine. Thank you.
Any further questions for Dr. Charles this morning? Nancy Maguire, good morning to you. Please go ahead.
Good morning. Do you have any understanding as to why people that have taken the first dose are not taking the second? Thank you.
I just want to clarify, there has been a decline in persons coming forward for their first dose, and as well the second doses, the uptake has been, declining as well. I mean, for persons, I would say this, there are different reasons for the delay. Most persons will come forward, but there is a delay in doing so for the second dose. But as to identify any specific reasons, I can't pinpoint any specific reasons at this time.
Gerard Joseph, I see you have your hand up. Please go ahead with your question for Dr. Charles.
Good morning, Dr. Charles. Good morning to the rest of the panel. Dr. Charles, you would have highlighted the period. What is the quickest period in terms of those who have received their first dose? In terms of them to become, well, to be to be noted as being not vaccinated. In terms of, okay, that person would have gone 3 weeks ago, the 21 days is up. How many persons stand to lose that status, that vaccination status?
Thank you for your question, Gerard. So you don't lose your vaccination status. There are certain categories you will fall into. For instance, somebody who have not received the dose of any vaccine, they will be considered as unvaccinated. If you had received the first dose of a 2-dose regimen, you would be considered partially vaccinated. If you receive 2 doses of a 2-dose regimen, 14 days after your last dose, you will be considered fully vaccinated. And if we did have a 1-dose regimen vaccine in Grenada, and you would have received that 1 dose, you will be considered fully vaccinated 14 days after. So I just want to clarify the status is either you're counted as unvaccinated, partially vaccinated, or fully vaccinated.
Thank you very much, Dr. Charles. I think we have one other question. Mikey, you have a follow-up?
Yes, I think the answer is a little unclear. That is why we're getting the same question asked in another way. So, after Dr. Charles, after you've had your first dose, and you hesitated, it was supposed to be 3 weeks after the first dose, or the other in another case 12 weeks or so, but that time has elapsed. It has elapsed to about 2 months, 3 months. What happens then? If that person has to be considered in terms of their vaccination status, is it that they have had a first dose, but now they will have to have another first dose again because the time between the first and the second is too far away, so they have to take another first dose, quote unquote? What happens in those scenarios?
Right, I understand now, Mikey. So I will tell you this, right? Once you received your first dose, you do not need to restart the regimen. If there is a lapse in that recommended time period, right? And the 2 time periods, you have as much as 28 days with Pfizer and AstraZeneca 3 months. So you do not need to come back to restart your regimen if there is a delay. If the time has passed and you come forward, you will receive a second dose and you're not restarting to get another first dose to answer that question. Thank you.
Okay, I trust it is clear now for everyone. Or do we have any follow-up questions along that particular line? If we don't, I'll move on to Linda Straker.
Well, actually, my question is follow-up along that line. Just for clarity purposes, if a person who has up to 3 months to take AstraZeneca, but waited 5 months, do they still have to just take a second dose or they have to restart? I think that will make it quite simpler. And then secondly, a few weeks ago, there were a shortage of AstraZeneca. Can the doc tell us now approximately how much we have in stock? And so that could that be responsible in a way for persons not coming forward because they're not aware that AstraZeneca is now available? And what is Grenada's stand on mixing vaccines? You have one AstraZeneca and another one Pfizer. What is our stand on that?
Thank you, Linda, and important questions. I just want to clarify that, and you give a time period, right? Once you receive a first dose, right, you do not have to restart the regimen, right, if there is a significant delay between doses. When you come forward, you will be counted as receiving your second dose of the vaccine, all right? And I hope that made it clear. Now, as it relates to AstraZeneca, we do have AstraZeneca on island, and we are offering 2 persons. In terms of the AstraZeneca stocks, I would say to you that the uptake with Pfizer has been significantly more than that with AstraZeneca. All right. In terms of the stocks we have currently, I would not be able to give you that number right now, but I can always relay that afterwards. Now, in terms of mixing vaccines, there is very strong evidence that shows that the immunity or the protection you get from mixing is good. And it's quite significant. And, you know, they had made comparisons with person receiving their first dose with AstraZeneca getting a second dose with an mRNA vaccine like Pfizer or Moderna, and vice versa. So that protection or level of immunity you get is just as good. And in some instances, reports that has been that it is slightly a bit better. In terms of our position, we support mixing, right? So person can receive a first dose with AstraZeneca and they can get a second dose with Pfizer and Moderna. And the reason for that is that there is a strong body of evidence to support mixing vaccines. So the Ministry of Health do support mixing.
Thank you, Dr. Charles. I don't think there are any further questions for you from members of the media, but before you take your departure this morning, I'd just like you to reiterate the importance of being fully vaccinated. I mean, it's fine to get the process started, but even more so to finish the process and to be considered fully vaccinated.
All right, thank you. Again, now it is very important to receive both doses of a 2-dose regimen. Because remember, after you receive 1 dose, your body develops a certain level of protection. But to get that full protection from vaccination, you need to complete the 2 doses, right? And that is very, very important. So I want to encourage persons to come out there and get their second dose, and even come forward. For the persons that are not yet vaccinated, come out and get your first dose of the vaccine as well. Remember, I mean, I may sound like a broken record, but vaccination is extremely important. And the evidence supports vaccination for centuries, right? Vaccination is very important in combating infectious diseases. And COVID is an infectious disease. Look in our region, the region of the Americas, we don't have to worry about measles. We don't have to worry about polio. But to date in Grenada, our last case of polio was in 1955. But we still see persons living in our communities with complications from getting polio back then. Right, so vaccination is extremely, extremely important, and it must be coupled with other measures. Remember, vaccination does not prevent exposure. What prevents exposure is wearing your mask, and all of these things, wearing your mask properly, right? Social distancing, right? Vaccination gives you a preventative measure. Vaccine primes your immune system so that if you become exposed to the virus, your body will react to it, right? And it's able to fight it. Your body already knows that virus, so it knows how to fight it. And for that reason, I encourage everybody to come and get vaccinated. COVID does not respect person. COVID does not respect race. COVID does not respect country. And throughout this pandemic, we have seen that. And now we have a safe and effective measure. Right now, this pandemic is being called the pandemic of the unvaccinated. So I want to encourage the general public. I want to plead with persons in the general public to come out there and get vaccinated. And I want to encourage you to continue to practice those public health measures, right? Wearing your mask properly, hand sanitizing, and social distancing. Because the science clearly shows that those interventions work, right? And this is the only way we can get back to some form of normalcy. I mean, when we look at the percentage in our population that is fully vaccinated, right, it is just about 29%, and that is our overall population. If we take it into account the denominator of 113,000, right? So that is still very low, and we are still exposed in Grenada. We are still at risk. We are still at risk of getting another outbreak. So we really need to improve the level or the rate of vaccination in our country, especially when we are talking about, going back to a sense of normalcy again. Vaccination is critical and it is crucial in that process.
One other question for you, Dr. Charles, before you leave, just to go back to a question that was repeatedly asked this morning, and to follow on from it. Now, is there a difference in the level of efficacy of the vaccine if you wait longer than the recommended period to get the second dose? So if I have to receive Pfizer and I don't take the second dose until maybe 35 days later, is there a difference in the efficacy of the vaccination?
As it relates to the efficacy of the vaccination, what there is, and the question that should be really asked, during that time period, that 35 days you did not come forward, I mean, your level of immunity or protection is not significant because you only receive 1 dose of the vaccine. So during that time, you're still exposing yourself, quite significantly, right? And I would say if you're going to do something, do it all the way. Because let's say you receive one dose, and this is hypothetical numbers. Let's say one dose gives you 40% protection, right? For that entire 35 days, you're walking around with 40% protection, right? And let's say the 2-dose ramps up your protection to 80%, right? There is no decrease in efficacy, but there will be a delay in that time period when you have reduced protection and so continued exposure.
Thank you very much, Dr. Charles. We will relieve you now to get to your next engagement. Thank you so much for being here this morning.
Thank you.
So at this time, we will change the subject to education, and we will begin with the registrar, Mr. Nicholas Paul. Mr. Paul, good morning to you, sir.
Good morning, and good morning to all our listeners. I will do a brief report on the preliminary results of the 3 exam areas that we covered, namely the CCSLC exams, the CAPE exams, and the CSEC exams. We start with the CCSLC exams. There was an overall pass rate in the CCSLC exams of 81.96%, and that was in 5 different subject areas. We had 87.7% in English, 90% in French, 75.49% in math, 88% in social studies, and 94% in Spanish. Briefly, we go to the CAPE exam. In the CAPE exam, we had an overall percentage pass rate of 93.04. Just to split the Unit 1 and Unit 2, we had 89.25% pass rate in Unit 1 and 95.85 in Unit 2. Just to mention here, there were a number of subjects in the CAPE area where we had 100% passes, and that was for Unit 1, Art and Design, Caribbean Studies, Environmental Science, French, Geography, Literature and English, Spanish, and Entrepreneurship. And in Unit 2, we had Applied Math, Art and Design, Economics, French, Geography, Information Technology, Literature in English, Spanish, Entrepreneurship, and Tourism. We move to the CSEC examination. The overall pass percentage in the CSEC examination this year was 71.7%. That was a decline of 5.6% from 77.3% in 2020. Just to note, mathematics and English, there were decline in percentage pass rates in both math and English. Unfortunately, mathematics was our lowest performing subject in 2021, 38.59%. It was 34.98% in 2021. English declined slightly too, from 82.65 to 71.7% in 2021. Just to quickly note our top performers in the exam, and the top performers are rated based on the number of grade 1s that are received in the exam. So we had Kana Gittens from the St. Joseph Convent, who wrote 17 subjects and received 17 grade 1 as the top performer. And then we had 2 students writing 16 and getting all 16 grade 1s, and that was Timothy Stanislaus from the Hillsborough Secondary School and Diane Fakre from the Westmoreland Secondary School. Those two students received 16 passes. Overall, we had 20 students achieving 10 or more grade 1s. And it is significant to note here that 10 of those 20 students were from the St. Joseph Convent, St. George's. So that's just a brief report on the preliminary results. But there's just something else I would like to note here. The 2020 examination cycle is over, and we are currently in the 2022 cycle. So registration, normally we have 2 periods of examination. We have January exams, and we have May-June exams. The January exams are scheduled to begin sometime very early in January. I think it's on the 3rd or 4th of January. However, the registration period for the January exams, tomorrow, Wednesday the 20th, will be the last day for making your payments and registering for the January 2022 exams. We have had a number of persons who came in to register already. We're just making an appeal to those persons who are thinking about it still. You have today and tomorrow to complete your registration. For the May June exams, which we actually started the registration for this already. The final day for making payment for the registration is going to be on the 29th of this month, October. So we should just take note. For the private candidates writing exams in January, it's also important to note that after payment is made at the Treasury or sub-office or any of the revenue office, the receipt must be brought to the Ministry of Education where the final registration would take place. Thank you very much.
Thank you very much, Paul, for sharing that update with us. Members of the media, any questions specific to the presentation that was just made by Mr. Paul, the registrar in the Ministry of Education? He informed us of the results from the various exams that were just released, and at this time we say congratulations to all of the students. As a former conference girl, I am particularly happy to hear that we had, of the top 20 performers, SJC had 10 in the mix there. So that's certainly good news as a former student of the St. Joseph's Convent, St. George's. Any questions from members of the media for Mr. Paul? You can indicate by a raise of hand or a message in the chat. Mr. Paul, okay, Gerard Joseph, GBN, go right ahead with your question for Mr. Paul.
Okay, my question for Mr. Paul is, we have highlighted significant drops, mathematics, language, English A. Have the ministry pointed out or identified the rational reasons for the drops in those subject areas?
As I mentioned earlier, the results are preliminary. An in-depth analysis of the result is going to be done at a later time, and I guess all those the reasons for the fall, they're going to do all this analysis, and I guess later on, sometime in the not too distant future, all of that would be addressed.
Gerard, do you have any further questions?
No, that's it. Thank you.
Thank you. I see we have Mikey Hutchinson. Oh, Mikey said his question was just asked. If there is nothing further for Mr. Paul at this time, we will move on now to the Minister for Education, Human Resource Development, Information and Religious Affairs, the Honorable Emmeline Pear.
Thank you. Thank you very much, Philo. Good morning to you. Good morning to all of our viewers and our listeners this morning. I want to continue by first of all extending congratulations to all of our students who have had successes in the 2021 CXC examinations. And of course, it's a suite of examinations, so you've heard them explained this morning. Of course, not just those persons who have excelled and who did extremely well, but of course those persons who excel and did well to the best of their ability, right? So you may not have gotten 15 ones, but you tried very hard and you are satisfied with your performance. Your teachers are satisfied with how you did. I want to commend everyone across the board. But I always make this additional point to those persons who did not do as well as they expected, as well as they wanted to do. They're probably not very satisfied with their performance. I want to just add that point, and I consider it very important. This is not the end of the world. This is not the end of opportunities that you would have. It is not the end of possibilities of success. And so I encourage you this morning, get up, dust yourself off if you're disappointed, and move forward. You know, there are so many opportunities out there. There are so many chances out there for success. Do not give up on yourself. Do not give up on yourself. And so this is my encouragement to students, to parents. I say to you, please, I beg of you, encourage the students. This is a time, the results are gone, and I like to say, after you've read the results, you've digested it, it's gone. It's time to move on. Encourage them to reach their fullest potential and to move on in the best way that you can help them to. I also want to extend commendations to the examination unit, Mr. Paul as registrar, and all of those who have been working so aggressively to put together all of the reports and to have everything available so that we can share this morning. And of course, not just that, all of the behind the scenes work that took place. He would tell you the early mornings and the late nights. So I want to recognize the examination unit, but I want to especially recognize all our principals or teachers or parents, education officials, of course. And last year, someone reminded me, Minister, you don't congratulate and commend those private institutions that offer support to our schools. Yes, our private tutors, I want to recognize you as well. And all of those who have contributed in one way or the other. Having had a detailed enough presentation on examinations, I just wish to say one thing based on the question that was asked. I give the assurance that within this month, before the end of October, a public statement will be made and the launch of a special initiative to address the subject of performance in mathematics and English. Now I want to bring the public up to date with some decisions taken at Cabinet yesterday as it relates to the expired protocols. And those are the regulations with regards to COVID-19. Changes. First, the dropping off of and the picking up of children at daycare. As you would recall, the previous regulations indicated that persons doing so must be fully vaccinated. The change to that is that it is no longer required, and all of these facilities would make special arrangements to ensure that these persons do not enter the facility and that there is care and protection in the manner in which students or children are dropped off and picked up. Dive shops can now open. Drive-in schools can now open. Call centers opening with mandate for employers and employees to present vaccination status to operate and to work. I just want to make a point there because normally this is referred to generally as mandatory vaccination. I just want to say whenever government make this request, it is based on concern for the health and safety of those persons and that those persons do have a choice. So you can choose to open now or to wait later when you have greater clearance. I would speak later as it relates to decisions with regards to churches and schools in more detail. The other area that I want to make reference to is that the decision, the curfew remains as is. But just to give some measure of comfort, I know that this is a major concern for many persons. Of course, our safety and security, this is the concern. But Cabinet has discussed and is going to look at reviewing this further for the next amendment to the regulations. So just to give that assurance to the general public, there are two areas that Cabinet has decided to make some amendments to, providing that the situation remains the same or improves, and that is going to be the issue of the curfew and travel to Carriacou and Petit Martinique. So I just wanted to give that advance in terms of what Cabinet is looking at. Social gatherings and weddings are still prohibited. Individuals can still obtain marriage licenses. Wedding is a social concept, and that is what is prohibited, not marriages. So you can still get married. What we're saying is that this ceremony type that takes place in our traditional custom way. This is what is the concern at this time, and Cabinet is also in the process of reviewing that, possibly consideration for the next review. Let me now move to the subject of churches and then to schools. I want to start by saying and expressing sincere appreciation to our religious community for their support, their coordination, their participation in the National Days of Prayer. I'm a firm believer that prayers can move mountains. And so I want to thank them for their participation and support and their activities during that period. And I do believe very strongly that a combination of faith and works always makes a difference. And so in the same breath, I want to express appreciation to all of our frontline workers and all of our volunteers for all that they have been doing. So the work of our frontline volunteers, the frontline workers and our volunteers, and of course the work of our religious community as we continue to fight COVID-19. In making the announcement as to Cabinet's decision with regards to churches and the operation, let me just remind the general public, and I think this is extremely important, as to how Cabinet concludes on matters which relates to the operation of churches during COVID-19. According to our records, there are over 340 churches in Grenada. That's just according to the records in the Ministry of Religious Affairs. During this period, the ministry, representing, of course, governments, would have held consultation with the different organizations representing these churches. So this includes the Alliance of Evangelical Churches, which consists of over 136 registered churches. The Conference of Churches, which includes the Roman Catholic, Anglican, Presbyterian, Methodist, Grenada Baptist, Spiritual Baptist, Salvation Army, Josiah Reformation Center, the Seventh-day Adventist, and Moravian churches, both of which have observer status on the Conference of Churches. Added to that, the Islamic faith and others such as Rastafarian, Jewish community, which are not as organized in terms of a representative body as we are aware. I want to say this morning that from the inception of our work in fighting COVID-19, the government of Grenada has been making decisions after consultation and engagement of the bodies that represent these groups that I just referred to. There has never been an occasion from the start of COVID-19 to this point where the government on its own has taken any decision as it relates to how churches function during the pandemic. There's always been a coming together of these representatives, making recommendations to government, and as far as I could recall, in almost every case of recommendations made to Cabinet, Cabinet has approved those recommendations. I'm making this point to say that the current regulations that exist, which says that churches are allowed to open with a maximum of 20 persons, was a decision of representatives of these religious organizations meeting to discuss how do we reopen. They expressed concerns about the level of deaths. They expressed concern about the level of hospitalizations. They expressed concerns about the level of cases, the number of cases. And as a result, they recommended that there should be 2 weeks of waiting before a decision to reopen in the previous format is tabled to the government. 2 weeks actually expires tomorrow, Wednesday. And so they have met, and they have again submitted to government their new position as it relates to how we should proceed. And I wish to say that government has agreed to proceed on the new recommendations tabled. That is, that our churches will reopen with immediate effect with their full numbers as far as 6 feet physical distancing allows. So this is the new recommendation that has been reviewed, and this is the government's position, that based on the feedback from the Ministry of Health, the technical officers, and this current status as it relates to COVID-19, that we can approve this. Let me now move to the subject of the reopening of schools. I want to say that the reopening of schools is a totally different matter, far more complex than probably any other matter that relates to opening, because we are dealing here with children, one. We are dealing here with large number of persons, and not just children, but the stakeholders are also wide and varied. And so the question is, how do we make a decision with regards to the reopening of school? We cannot use emotion, we cannot use fear. And so a very strategic approach has been used as it relates to the reopening of school. And so I want to take my time this morning to walk us through this process because of the wide-ranging views and opinions as it relates to reopening of schools. I'm going to attempt to share my screen at this time, if I'm given permission. I want to start by indicating that during the last week, consultation has been held with various representative groups in the education sector. The Education Advisory Council, the boards of management of denominational schools, the Grenada Union of Teachers, principals of public and private schools, parents, and students. And I must say this has been a very rich experience, not just for me, but for officials of the Ministry of Education, who I also consulted with. During this process of consultation, there are many concerns that were raised at different levels. And I want to make reference to the academic concerns associated with remote learning. Students who have not been engaged in remote learning since the start of September is of significant concern to the Ministry of Education and by extension the government of Grenada. Some of these students have never been engaged during a lockdown or shutdown or online learning period since the start of COVID-19. Second, exam readiness of students in exit grades is also a major concern. And the pressure that students are often placed under when they have to prepare within a very short time. As one student said to me, "Miss, CXC not waiting on us." So that's another factor to be considered, the readiness of our students. Another area of great concern, also featured during the consultative process, is what is happening to our early learners during this period. Students who cannot be engaged in any significant way online. Low-performing students, those who are way behind. As a matter of fact, long before COVID, the statistics told us that there are some students who are reading 2 grades below the actual level. Students with special education needs who have to adapt and who have to function as adults in our society. We are also extremely concerned about this category. We are also concerned, and we're raising academic concerns here, teachers who are not reporting and engaging their students, even if they do have connectivity and they do have a device. And I might add here that this does not represent the majority. Teachers whose lessons are of poor quality due to constraints of the virtual environment. And we understand that this is new to most of our teachers. Even if we have been providing significant support, it takes time to get experienced in this area. In addition to the academic concerns, there are also the behavioral concerns associated with remote learning. Insufficient parent control and unsupervised students. Extremely critical for us what is happening with some of our students while we continue online learning. And we also have the students at risk, psychosocial issues as well as domestic issues. There's been several reports and concerns expressed as it relates to abuse of minors by older siblings and relatives, inappropriate sexual activities, and we have even had reported in a previous period 3 known cases of pregnancy among primary school students. Suspect attempted suicides, accidents in some cases, or at least in one case that I'm aware of, leading to death. And those are during school hours. Reports of students loitering in various places during school hours. Those are the concerns from a behavioral perspective. I want to also take this opportunity now to look at a few trends as it relates to national exams. And Mr. Paul has clearly made reference to this year, what has happened as it relates to math and the decline. I believe last year we were quite comfortable that there was a trend that demonstrated upward improvements in that regard. And we are concerned that based on the current situation, particularly in math and English, if we continue to lose contact time, that this would only get worse. The trend as it relates to remote learning. Teachers' engagement, and I'm using an example of week 3 of this present term. Of a total number of teachers and staff, 1,551, total number of teachers submitting remote learning data, there's a total of 1,086. Percentage of teachers submitting remote learning data, 70% of our teachers. And so we are also concerned, what is the actual situation with these students who are not reported on? The data trend as it relates to students, very important. And I'm taking my time to do this morning because whatever decision we make as it relates to the reopening of school, it has to be in the context of the reality of the situation. Students' engagement for week 3. The number of students enrolled, 21,932. The number of students engaged in remote learning at this time, 80% or more of the times, only 12,214 students. Therefore, the percentage of students with satisfactory participation in online learning is only 55.7%. There is significant cause for concern of what is happening to these other students who are not engaged. Therefore, the Ministry of Education, having been guided by the Cabinet and the Ministry of Health, that it is safe for some measure of reopening of school, we are now advising the general public that from the 1st of November, for a test period of 2 weeks, we are going to be reopening school under the guidance or the guidelines that I will now share. Priority for resumption should be given, 1, to students in exit grades. Priority 2 is given to students who have not been engaged in remote learning with their teachers for varied reasons. I wish to quote one student who shared during the consultation last Sunday his exact words. Returning to school is a risk, but it is a risk that is worth taking. Phase 1, November 1st to November 12th. This phase of 2 weeks, for those children who are disconnected remotely, they will have an opportunity to meet with their teachers face to face. And this will be the arrangement. Secondary schools on Mondays only, Forms 1 and 2. Tuesdays only, Forms 3 and 4. And this is only for the students who are disconnected from classes. Primary schools, Mondays only for KG to grade 2. And Tuesdays, grades 3 to 5. 4+ students, Wednesdays to Fridays. Let me also make the point that during these 2 weeks, all of our truancy officers or school attendant officers will be engaged to follow up with parents and students to ensure that they comply. Phase 1 continue. Primary level, grade 6 only from Wednesdays to Fridays. And secondary school level, Form 5s only from Wednesdays to Friday. Let me also make the point that as it relates to these categories of students, students with underlying conditions are encouraged to remain at home. Parents who are significantly traumatized about the idea of their children returning to school, we ask them to use those 2 weeks to become a bit more comfortable. Phase 1, November 1st to 12th. Only students disconnected remotely, T.A. Marisho Community College, Mondays and Tuesdays, year 1 only. And Wednesdays to Friday, year 2s only. So if you realize the trend, the exit grades and forms and classes are Wednesdays to Fridays, 3 days per week. Mondays and Tuesdays specially designated to engage and to follow up with students who have not been demonstrating any interest at all in online classes or for some reasons have not been able to connect. Private schools. Private schools shall submit an electronic application seeking approval for resumption. Approval shall be granted on a case-by-case basis according to several factors, and this can include number of students and the size of the school. Monitors will be assigned to follow up and to check for compliance. Of course, as you know, some private schools extremely small and others may be the size of a regular public school in few cases. Other factors for consideration. There are some schools in which construction is ongoing. The principal, the maintenance officer, and the contractor will make a decision as to whether work continues or a different schedule is developed for continuation of the work. We will continue to provide cleaning supplies and personnel for sanitizing the schools. Students with special education needs and other medical conditions are encouraged to remain home during this phase, this 2-week phase. Finally, vaccination. While vaccination is not mandatory, the Ministry of Education, in keeping with the guidance from the Ministry of Health, encourages all teachers and all parents of students 12 years and older to ensure that in the case of teachers, they are vaccinated, and in the case of parents, to ensure that their students are vaccinated. I repeat, vaccination is not mandatory. However, we are convinced, we are of the view strongly, that it will significantly reduce any possible spread of COVID-19 as we return to school. I end with the quotation of that student from the West again. Returning to school is a risk, but it is a risk worth taking. And so I appeal to the general public to continue to pray for all of our stakeholders in education. It is extremely important, not just for academic reasons, psychosocial, many other reasons, that our students be given an opportunity to go back to school. Thank you.
Thank you very much, Minister Pear, for that very thorough presentation on the new guidelines coming out of yesterday's cabinet meeting, and also the updates as they relate to churches and schools. At this time, we'll open the floor for questions from members of the media. We have a number of media representatives present this morning. I see MTV, Mikey Hutchinson. Well, he has already asked questions this morning. We have Nancy Maguire, Linda Straker, Gerard Joseph, of course. Any questions from media for the minister?
Yes, good morning, Minister. On days when the teachers are paying attention to those who were not engaged, so now they are on the school compound assisting those students, what happened to those students who were engaged in online learning? Is it that they have a day off?
Excellent question. And of course, I'm sure by now you recognize that a decision to do this is, or to do anything at all, is not an easy one. And you have to look at so many factors. What we have decided to do is that the teachers who are in school providing support, they are going to use their devices to connect during the same time with the students at home. So this morning, we had an officer, technical officer again, visit one of our schools, and I received the report of how possible it is to use a device, the laptop that is provided to our teachers. That laptop placed at the front of the classroom, and it captures the entire blackboard and the teacher teaching at the front, teaching to the students in the class as well as those who are home. Let me make this point, that I don't expect that in week 1 this would work out perfectly. What does? Very few things work perfectly. But it gives us an excellent opportunity, not just for COVID-19, but for other situations. And I want to use an example of a student from my constituency who had to stay home more than about 6 months for medical reason and could not engage in the classroom. If we get this right, not just for COVID, for many other reasons, students are going to benefit in the long run. So this is actually another level of testing for us to ensure that this works. But also, as you know, the provider for the service in our schools as it relates to high-speed internet is Digicel. We have been working with them. We were able to beautifully sort out some challenges for the CSEC examination. And believe it, we were able to do our CSEC examination in our schools online. And so we have confidence that this is possible. There would be some teething problems, I expect that. But we have confidence that this is the way that we should go so that students in the classroom, students at home will benefit from this experience.
Mackie, anything further from you at this time?
Yes. Well, I know that quite a lot has been mentioned here, Minister. Is there a desk that parents can contact in order to get some more clarity on what was discussed here this morning or what was announced by you this morning?
All further information will be communicated to parents from the desk of their principal, the principal of the student of the school where the student attend. So the ministry will provide detailed information to the principals to teachers, teachers to parents, and this is how it has worked in the past, and this is how we anticipate it will continue to work. And together, I mean, we have achieved so much together. I only anticipate that we would do even more as we move forward.
Thank you for your questions, Mikey. We move on now to Linda Straker. Linda, please go ahead.
Good morning, Minister. You focus both on the private school and on the public school. I am gathering that most of what was said is for the public system. Now, with regard to vaccination, can private schools mandate that the teachers be vaccinated? We will see public sector workers being told in some area that they have to get vaccinated. We are fully aware of what is St. George's University policy. These are private institutions. Can that be allowed? That the teachers in private school be vaccinated? Can that be a mandate?
Okay, very relevant question, Linda. Over the past month, we've received requests from private schools for reopening. And in every case that we received that request, they said to us, we understand that public schools are closed, but look, the parents of our children in those cases that made the request, the parents are vaccinated or teachers are vaccinated. Please, Minister, could you consider us for reopening? So that is why we say case by case, because the situation in every private school may be different. So there may be a case based on the size, based on other factors, that we may say to them, yes, all of your grades can come back, but this is the condition. So the number of grades reporting for the private school would be dealt with case by case based on their size. And of course, it's a business, Linda, so the business can apply its own guidelines and so on for its workers.
That's the very reason why I asked. My other question is, you did mention that persons can get married, but there should not be no celebration, neither with 10 persons, not 20 persons, no celebration. With regard to funerals, over the past 3 weeks or so, we would have heard of new regulations with regard to funeral. As Minister for Religious Affairs, can you tell us if any family is allowed to make special provisions, special consideration and application to have more than that 20 persons attend? I'm asking that based on the background of what I saw yesterday and a funeral that was broadcast live. Is there an arrangement written for exemption to include more persons than the 20?
Right, so I have not seen the funeral that you're referring to, but what I can say, Linda, is that the current regulations remain. And with those regulations, Cabinet is currently reviewing based on recommendations, again, from the churches for certain considerations. Now, remember the churches did indicate that they had serious concerns about having funerals in churches at this time. And some of the challenges, as a matter of fact, I actually laughed when one person said, we're even having problems getting people to lift the coffin now because people are not sure if the person that died had COVID or did not have COVID. So there was some concerns raised and a request to move all of those funerals graveside. There is on the table some new requests as it relates to funerals, and those will be taken up on Monday, I'm sure in time for the next amendment, but the current regulation stands.
Thank you for your questions, Linda. We now move to MTV and then to Nancy McGuire. MTV, good morning to you.
Good morning, Minister. Rachel Bain here, MTV News. My question is, how do you determine who are the students that are not being reached, considering there are some students who have access to the internet, they have access to the online learning device, but they are having challenges in terms of the classes, how it is structured and stuff like that. How do you determine who are the students? How the students are? How do you determine who are the students that are not being reached? That's one. And two, which platform proves to be very efficient? Because from my understanding, teachers are using Google Teams, Microsoft Teams, Zoom, Edmodo. I think it's 4 platforms. Which platform proves to be more efficient? And my third question is about the apps that are blocked on the devices. Because there are some teachers who are sending work and directing the students, sending links to the students to use YouTube, but when they go to YouTube, it is blocked. They don't have access to it.
So I'm going to try to, I think I captured the 3 questions. How do you know who is reached? The teachers are supposed to be keeping a register of students, just as they do when there's a face-to-face engagement. So that record is available, right? So that is what is going to be used as it relates to these parents and these students. As it relates to the platform, let me just say that we are gradually moving towards establishing a cutoff where we would say these are the platforms that are to be used and those only for reasons A, B, and C. We are in the process. So for example, we have provided our secondary schools with certain platforms to facilitate online teaching as it relates to a class, hosting of a class online. We have actually started rolling out for primary school additional support in that regards. But we have given guidelines to schools in options and options that they can use as it relates to engaging students. Now, I want to also make this point that at this point, because of the challenges that we have, we do not have a problem if the teacher is using something creatively to ensure that they reach students. There's no rule that say, no, you cannot use that. The apps and what is blocked, this is only for safety reasons. There's only one reason any app is blocked. Now, some parents operate with a policy at home that you can view anything. And the evidence is there that some parents allow their children to view anything. There are some parents who feel strongly about this, that there are some things they do not want to expose their children to directly. And of course, we can debate they would other ways, but that's their policy. And so we feel the same way, that every app should not be available to every child, even if that child may have other means of accessing that app. And hence the reason we encourage teachers to use other sources where those apps are not made available on the device. So whenever app is not there, there's a particular reason why it's not there.
Thank you, Minister and Rachel Bain, for your questions this morning. Our final questions this morning. Nancy McGuire, please go ahead.
Good morning, Minister. You had mentioned that there are some schools that may not be ready to open for the 2-week test period because they're under construction. Can you tell us how many schools would be in that category? And I know you had said that vaccination will not be mandatory for teachers, but do you have any idea of how many teachers and education officers in the schools are vaccinated? We recall the Prime Minister had said the rate was abysmal, so do you know where it's at now? Thank you.
So as it relates to the issue of construction, as you know, during this period, we continued working on our schools, the fact that students were out. Every school, when it comes to the reopening date, there is still a little window for a case-by-case basis, meaning, let us imagine the 2-week period that we spoke about, that because we just announcing this today, the contractor and the principal and others agreed they were going to take off the roof, and this is just an extreme example. And you can get the roof on back within the 2 weeks. Of course, in this isolated case, we may say they reopen 1 week later. But I doubt that we would have cases like this where you have any school where the extent to construction would prevent the school from opening. I do not believe that we have that extent of construction that we cannot stop, or we cannot defer to a later date, or we cannot change the program to say after 3 o'clock or on weekends. I'm quite confident that we don't have cases like this, and if we do, very, very minimal.
Thank you very much, Minister. And as we bring an end to this morning's proceedings, I just want to go back to Registrar Nicholas Paul, just to give another reminder of the imminent deadlines we have for students. I think there's one tomorrow for registration, and also October 29th. If you can just repeat that again, so that the public goes away with that on their minds.
Yes, for good morning again. For the January examinations, the deadline for registration, for making payments and for registration is tomorrow, Wednesday the 20th of October. For the May-June exams, both CAPE and CSEC, the deadline for registration, making payment and registration is the 29th of October. I need to make a special appeal to some candidates. In the past, we have had candidates who paid for the exams and kept the receipts to themselves. Therefore, they were not registered. And at the end of the period, when the timetables arrived, they were coming in to collect the timetables with the receipts in their hand. So I'm making a special appeal to everyone here. After payment is made, the receipt, and that is for private candidates, the receipt must be brought into the examinations unit at the Ministry of Education for registration to be completed. Just want to make that special appeal to candidates writing exams. Okay, thank you.
Thank you very much, Registrar Nicholas Paul. And Minister, your final words this morning. Can you also include, Nancy was seeking clarity to her second question in terms of the vaccination status among teachers now.
Nancy, my apology for not getting that one. As it relates to the vaccination status of teachers, I do not have statistics on that. We made an attempt last week to gather that information. There was some reluctance. We didn't think it was necessary to go other ways to obtain it. So at this time, we are still collecting that data as it relates to teachers who are vaccinated. I just want to close by making an announcement that as of Friday last week, the T.A. Marisho Community College now has a new principal in the person of Dr. Ronald Brunton, and I want to use this opportunity to welcome him. I want to also use the opportunity to extend publicly my profound appreciation to the former acting principal, Dr. Britton, who have given years of service to the college, who have given a lot of sacrifices in his role as acting principal. And I wish to say publicly that Dr. Britton, though on vacation presently, has indicated from day one his willingness, knowing that the college has always been on a search for a principal, his willingness to give full support to whoever emerges to be principal of that institution. So I want to publicly express to him my appreciation for his many years of holding the fort, his many years of service. And finally, just to alert the public that at the end of this month, we will be having a launch of our national ebooks program, and I encourage parents and all concerned to take note of this. The ministry will be communicating information soon. In closing, I would just close on one note. And again, I repeat, opening school is a risk, but it is a risk worth taking. And I'm sure that student would realize I've used his quotation about 3 times for the morning. I appeal to everyone. I appeal to everyone. Just as with other institutions, other organizations, other businesses that have been open, let us continue to exercise all the necessary precaution. Let us continue as we go out to observe the protocols, the physical distancing, the sanitizing, the washing of hands. We are not going into a perfect situation, but I believe that we do have the ability to manage ourselves appropriately in following all of the required protocol. And I end by saying, vaccination can indeed assist us as we roll out the reopening of school to reduce the possibility of spread and further outbreak of this virus. And I want to encourage teachers, encourage students through their parents to get vaccinated within this 2-week period in preparation for the gradual reopening of school. Thank you so much.
Thank you very much. That was Minister for Education, Human Resource Development, Information and Religious Affairs, the Honorable Emmeline Pear. We also had this morning Registrar in the Ministry of Education, Mr. Nicholas Paul, and earlier we had an update from Dr. Mariana Charles of the Ministry of Health. That brings us to the end of this week's Post-Cabinet Press Briefing. I am Philomena Robertson. Thank you so much for tuning in, and do continue to stay abreast of developments with reliable sources of information, including the Government Information Services. Until we see again, continue to be safe.